So, you know I like quotes, and so I saw these two. Leaves are supposed to fall, people aren't. So safety doesn't happen by accident. It's simple, but a crucial truth. As we navigate changes that come with aging, today's seminar is all about giving you the tools and knowledge to stay safe, mobile, and independent. Because let's face it, nobody wants to trip over a rug or deal with a fall at the wrong time. Speaking of falls, Rick's mom fell at Thanksgiving when we were over there in Arizona. Just a little fall that hurt her knee. So it's like we want everyone to be safe. We're lucky today to have 3 amazing experts with us, each bringing their own special set of skills to help us prevent the falls and make our homes safer and live with more confidence. So I'm going to invite them up. Let's give them a hand first, and I'll tell you a bit about them, and then they'll introduce themselves. Come on up. So Karen is the founder and owner of Senior Choice. She's a certified aging in place specialist and a fall prevention specialist, and on the San Diego Fall Prevention Task Force. Kendra in the middle is the founder and owner of 101 Mobility of San Diego. She's a mobility consultant, certified aging in place specialist, fall prevention specialist, and on the San Diego Fall Prevention Task Force, and Caregiver Coalition of San Diego. Dave is the doctor of physical therapy, is the founder and owner of 19 Sports Medicine and Physical Therapy. He is certified strength and conditioning specialist. He specializes in sports injury prevention and sports injury rehabilitation. So let's get started, learn how to make safe and fall prevention a priority without making it feel like a chore. And I am turning over the clicker to Kendra. So when you guys use this, the green light means on, and turn it down for off. So when you're not speaking, have it off. Okay? Thank you.
Fantastic. Thank you so much for the IT assistance. Now I gotta go which way to put these. So, as Christy mentioned, my name is Kendra French. I'm so happy to be here with you today. I do have one minor correction on my bio. I am the former owner of 101 Mobility. I'm still part of the 101 Mobility team, but we transitioned. My husband, who was running the company with me, retired, and I know what I'm good at and what I'm not. I don't want to run a company all by myself. So we transitioned our ownership actually a couple of years ago, and it allows me to focus on things that I really enjoy, which is helping people make their homes safer, meeting people with people in their homes, and taking care of grandbabies, because that's important too. So we are here to talk about fall prevention. Fall prevention is, kind of sounds boring, but it's so important. So there's a lot of myths around falling. People believe that if it's going to happen to someone else, it's not going to happen to me. A lot of times people think that once I've lost it, that I can't regain flexibility. But there's some evidence to suggest that that's not true. Some people think if I limit my activity, I won't fall. Anybody believe that? Anybody thought that? I've seen people think that. If I stay home, I can avoid falling. These can be fun conversations. Or falling is something normal that happens as you get older. Is falling normal? No, Christy put up that beautiful quote that leaves are supposed to fall, people aren't. So today we're going to talk about some of the things that we can do to help reduce our risk of a fall and show that these thoughts are not the right thoughts. Okay, I am happy to report that first statistic, 1 in 4 older Americans fall each year, is a revised statistic. A couple of years ago, it was 1 in 3. So when I would share about fall prevention, I could say, okay, who's had a fall in the room? Raise your hand if you've had a fall. Don't be shy. Okay, look around. No, keep your hands up. Look around. Don't be shy. You're not the only one with your hand up. So you can see that that is at least a fourth of the people in the room. Probably a little bit more. I didn't count, but you know. But when it was 1 in 3, it'd say, you know, look to your left and look to your right. If it's not one of the people you just looked at, it's you. Well, we've got some better odds. This means we are improving, we are learning, we are making changes to improve the statistic. That's awesome. Now, the risk of a fall does increase with age. Some of that is because of changes we make in our habits. Some of that is because of changes that physically happen in our bodies. And having a history of falls is also a risk factor when it comes to falls. Meaning, if you've had a fall in the past, so those of you who raised your hands a few minutes earlier, your risk of a fall, of a second fall, is actually higher. Yay! Aren't you glad you came today? So, yes, I'm so glad you came today, because you can learn how to reduce that risk and blow that statistic out of the water. So that's what we're here to do today, is overcome these statistics and prove them wrong. So, okay, at my church, we have a speaker, and he literally stands like this the entire time. He stands on the edge of the stage with half his foot off. He's also 23 years old. And my mama mode comes in like nobody's business, because I am constantly worried. And our stage is about 3 feet off the ground. So I'm constantly worried that he's going to just roll right off the edge. We used to have a light bar that was right behind his feet, and I was always worried he was going to step back and trip over it. Actually, I was kind of waiting for that one. Is it your turn?
Nope.
Oh man, I got one more.
Fall cycle.
Oh, the fall cycle. This is fun. Okay, so when you have a fall, one of the issues that happens is now there's a change in your mind. Now there is a fear of falling again. Because it's happened once, oh gosh, now it could happen again. So what happens is, whether it's a conscious choice or a subconscious choice, we start to become less active. We stop doing things that we think are going to create a risk of falling. I stop going places because what if I step off a curb wrong? Or what if I go to my neighbor's house and their furniture is too close together and I trip over it? We start to become afraid of doing things, normal activities, and that inactivity then results in loss of muscle strength, loss of mobility. So that fear of having another fall is leading to inactivity, which can lead to weakness, which can result in more poor balance, which can result in an increased risk of falling, resulting in another fall. So once a fall happens, this cycle can start to occur unless we break that cycle. And that's what we're here today, is to talk about a few evidence-based ways that you can break that cycle and reduce that risk of falling. We want to reverse this. Okay? Karen.
Okay. All right, hi everybody, I'm Karen, and I'm going to talk to you about the 4 steps you can take actually to prevent falls. Because how many of you like to take action in what you're doing? Or are you more passive and, I fell, whatever, right? It makes a difference. You have to take action, you have to speak up and talk to your medical provider about what's going on. How many of you who have fallen have told their doctors? Not that many. How many of you have your doctors ever asked you, have you fallen? More, that's good. And that's something the Fall Prevention Task Force we've really been encouraging, is getting doctors on board and knowing the importance of fall prevention and asking those questions when you go. But also, as a patient, a lot of times people are nervous to tell their doctor because that's going to mean some tests and a lecture maybe, or you don't want to tell your kids, that's for sure, right? I mean, definitely don't want to tell them because then you'll really get a lecture of how unsafe you're being. But you definitely do want to speak up. You want to share with your doctor because there could be some medical reasons why you're falling. You want to keep moving. How many of you like to exercise? That's good. I know you guys do. I like to do yoga. That's exercise and pickleball. But so keeping moving is really important. Whether it is doing yoga, tai chi, walking, jogging if you're so inclined, pickleball, whatever it is, keep yourself moving. Was I? Rock climbing over here, whatever. And so that's really important to just keep moving. Whether it's, even if it's just a walk to your mailbox every day. Sometimes, you know, you're having a hard week, you don't feel well, just getting outside in the sunshine, just keep moving. And David's going to talk more about that. And check your eyes. How many of you get your eyes checked regularly? How many times a year do you get your eyes checked? Or how many times in 5 years do you get your eyes checked? 5. Nice. 10? Someone said 10? That's a bit obsessive, but okay. So if you have problems with your eyes, then you need to get them checked more. But it's recommended once a year to get your eyes checked to see if there's any vision changes. And then make your home safer. And that's where Kendra and I and our businesses really shine. And we'll get more into that. So those are the 4 steps you can take. So, here's a problem. As we get older, or even when we're young, we have medical conditions. I'm going to read out a couple of conditions or medications. Raise your hand if they apply to you. Or do you have hypertension? Do you have high cholesterol? Arthritis? Heart disease? Diabetes? Kidney disease? And I could go on and on and on. Depression? Heart failure? Any of these type of medical conditions can increase your chances of falling. Number one, sometimes it's because of the condition itself. Other times it is the medication you're taking can increase your chances of falling. So it's something to be aware of. So that's why it's important to speak up. When you go to your doctor, go with a complete list of medication that you're on. Your primary doctor doesn't know what your cardiologist is giving you or whatever other doctors you see. They have no idea. Even though it should be in your chart, it sounds wonderful that all our charts are synced up, they're not. And so you really have to stay on top of it. Honestly, every time I go, one of the things I do, just as a little tip, is I take pictures of all my medication and I keep it in a file in my phone under my photos. How many of you guys have cell phones that you use for pictures? Do you know how to create a file? Or a little album? We can teach you later. You create an album and you call it medications and you just keep it updated every time. As soon as the medication changes, swap out your pictures and update it. It's great while you're traveling. It's great if something happens when you're out and about. Just a little tip. So keep a list of your medicines, the dosage and all that stuff, and then talk to your doctor about it. And another person people really don't think about talking to is the pharmacist. Your pharmacist, unless you go to multiple pharmacies, but usually you try to go to 1 or 2, they know what's going on with your medications. And this just happened to me recently. I'm trying to think what the name of the doctor is. Anyway, my doctor gave me a medication, and then they said, do take this with this. And I said, I just read online, it said, do not take it with this. I should stop it. And they're like, we'll check with the doctor. I'm like, okay. But I called the pharmacist, and the pharmacist said, absolutely do not combine those medications. The doctor's office called me back and said, nope, the doctor said take it. And I said, talk to the doctor again because I'm not doing it. I was like, I trust the pharmacist. She goes, but she's the doctor. I'm like, I really don't care. I'm the patient. And I'm telling you, I'm not going to do it because I talked to the pharmacist. I trust the pharmacist more because they know the interaction way more than the doctor does. And that's just, I'm not telling you to fight the pharmacist or the doctor. I'm just saying that's the scenario that happened to me. So, okay. So these are some questions you can ask your healthcare provider. How can my health be affected by risk of falling? How can my medications contribute to my fall? Should I be taking nutritional supplements? And can physical activity reduce my risk? So on your table, everyone was given a guide to preventing falls. If you didn't get one, we'll give you one at the end of the seminar. And it's put out by the San Diego Fall Prevention Task Force, which Kendra and I are part of. And we worked really hard at putting really good, helpful information. And these questions are in there, so don't worry. So quick self-assessment. Have you fallen in the past year? Do you feel unsteady when standing or walking? How many of you, when you get out of bed, and maybe in the middle of the night to go to the bathroom, how many of you sit at the edge of your bed and give it a couple seconds, maybe 10, maybe 20? Good, I like this. And then that gives yourself your chance to balance your equilibrium and then get up and go. That really does make a big difference. And how many of you worry about falling? Okay, I worry about falling. I fell recently. I was doing things I shouldn't be doing. I was on my cell phone looking. I was walking up a path and it had a step and I didn't see it and I went flying. And my foot luckily I didn't get very injured, I just got a swollen foot, but my ego was bruised for sure. And I was embarrassed because I shouldn't be looking at the cell phone and walking, right? You're supposed to be focused on walking. And so, but it happens. We all know, everyone's busy doing many things at one time. Okay, and now, here you go. Oh, you have your own list.
So thanks for having me. Again, my name is Dave. I'm as Christy introduced me, I'm a sports physical therapist, but one of the things I like to say all the time is we want to treat everybody like an elite athlete. So when we're considering, well, how many people have had physical therapy or have worked with a physical therapist? Quite a few. I would say, in my experience, what concerns me most of the time is we're seeking professional advice, whether it's a physical therapist or a chiropractor, or your physician, or as she was speaking about, your pharmacist. We're doing it retroactively instead of being proactive about it, so we're doing it in reaction to a negative event. So I think as you age, it becomes more important to be proactive about these things, whether you're considering your condition or your situation. And that'll kind of lean into what we're going to talk about with regard to fear. So fear of falling is a very normal consideration. What happens for the most part is it's a slow burn. As we build up, we're doing our normal daily activities the same way we've always done them, right? With the same cadence, with the same structure. Then we have a fall, and that becomes kind of this fear-inducing event because what we've done with normal regularity, now we think maybe we can't do it, right? Or at least can't do it in the same manner. And this is the same whether we're working with a professional athlete or working with a senior. If you have an injury or an event, it's going to have a setback, and then you have, unfortunately, you then have the fear that comes with that. One of the things I think is really important to consider when you talk about fear of falling is how do we build up our confidence again? So if you get knocked down, how do you get back up? And one of the ways we're going to do that, as in my profession, is going to be graded exposure. And graded exposure can apply also to prevention, and I'll link those two together. But essentially, what we're saying is, how do you do progressively more challenging tasks or more challenging activity continuously, right? And frequency is probably the most important thing. So speaking from an evidence-based perspective, there are two things that we consider. One is acute load, and acute is going to be in a short amount of time. So if I were to go for one walk, how long am I going to go for a walk, and how rigorous is that exercise going to be? That's going to be the acute load. What we care more about is the chronic load, and that's going to be over time, how consistently am I doing some level of exercise? And that chronic load builds, and this is with, again, professional athletes and seniors alike. That chronic load builds, and it in turn makes us more resilient. So the different types, how many people, just by a show of hands, do regular physical activity? Wow, yeah, I love Encinitas. This is a very active community we live in San Diego, and that's great. Now, when we talk about regular physical activity, most people are considering yoga, cycling, weight training, right? Those types of things. When we do our initial assessment, right, as a physical therapist, I want to get an idea of what's your life like. Those things may not interest you at all. So we might need to consider, how is gardening a physical activity, and how can that be strenuous in other ways, right? We're bending in different directions, we're getting down, we're getting up, right? So there's constant movement in gardening, benefits for flexibility, right, mobility, strength, all those things. So the couple buckets, and I'm sorry I don't have a slide on this, but if anybody wants, I can get you something either digital or in print. But the way we like to think about different types of physical activity is put them in buckets. So think about outdoor activities. We need to be outdoors. We live in a beautiful climate. So what activities can I do that are outdoors? So is it a walk? Is it gardening? Right? Those types of things. Is it taking the grandkids to the playground? Then we want to think about social activities, because a lot of social activities are going to be critical for our mobility, right, and obviously cognitive benefit, right? So, am I participating in clubs? Am I at a church? Am I volunteering, right? What are the other social activities that I can do? Physical activity is a bucket, right? And there's both structured and unstructured physical activity. So unstructured would be something like I'm walking around the yard, or I'm walking outside, or something like that. Structured physical activity would be in a class. I think most people, unfortunately, assume that in order for me to be doing exercise, I am doing a structured class. And that's absolutely not the case. There's a lot of different ways to get it. So, for example, right now, we've been sitting how long? Probably too long. Right? Can we all please get up? I love it. So now you're going to say this physical therapist made me stand up at this seminar. I thought I was going to get some education, and now we're back down. So now we're going to sit back down. So one of the tests that we do for fall prevention, we'll get back to fall prevention, I promise. So one of the tests, when you come to a physical therapist, and it looked like most of you have been to a physical therapist. Hopefully it wasn't for a fall that you had, but maybe it was. When you go to a physical therapist, we're going to be doing fall prevention on just about everybody, right? Anybody over the age of 60, absolutely. And one of the things we do is we're going to do a repeated sit-to-stand test. So we're going to take our objective measures. We're going to look at your gait. So how do you walk across the room, right? How quickly do you walk across the room? How well do you walk across the room? Are you using a cane, a walker, or another device? We're going to talk about those later. How quickly do you get up and down from a chair, right? And then stair climbing, oftentimes stair climbing. So those are the three, if you want to write anything down, those are the three kind of basic functional tasks that we need. Functional meaning they apply to our life. Sitting and standing, walking, and then stair climbing. And those are how we're going to get around our environment. So when we're structuring our exercises at home, think about, can I just sit up and down from my chair? If you have a really safe recliner or chair that you can get up and down relatively easily, that's a great exercise at home. And again, building that chronic load is really about frequency over duration. Let me check my notes real quick here. I'm not as experienced as these ladies with public speaking, so I gotta make sure I'm hitting everything. I'm sorry for those of you taking notes, I missed one of the buckets of activity, and that's hobbies. So important to consider your hobbies also as activities, so art or music, those types of things. So I'm going to say kind of my last piece about, we're going to circle back to fear. So I like to think about rolling a snowball, right, either down a hill, or this kid looks like they're going to have a hard time moving it across the walkway there. But when we do graded exposure is the term that we use, where we're going to progressively do slightly more challenging things. No matter the age of my clients, we always encourage you to toe the line. Find the threshold for you, right? And sometimes you need some expert guidance for that. But find where you're right at your limitation of challenge. Because if you're intentionally doing much, much less, you're going to degrade. There's no doubt about it. You have to challenge yourself, and you have to challenge yourself with some frequency. And sometimes that takes somebody to push us a little bit. But in doing that, in pushing the envelope and challenging ourselves in ways that we're maybe not so comfortable, that's how we build the confidence, right? And over time, that confidence reduces our fear of falling. So just to recap, frequency of physical activity, absolutely essential. Variability in exercise activity, right? Those different buckets we were talking about. So how are we staying active, but doing the things that we care about, right? Whether they're hobbies, whether they're family related, community related. And then building that confidence progressively over time. Oh, footwear, yeah. Perfect, thank you. Okay. Footwear is also very personal. Who likes flip-flops? Me too. How about barefoot? Me too, yeah. Barefoot in the house is not something I'm against. I like barefoot. So selection of footwear is very critical, of course, because when we're talking about navigating our environment, we're weight-bearing, right? Humans. We're bipedal. So we're constantly on our feet, and the choice and selection of footwear is very critical. We do assessments on everybody's feet. I know, can I speak, Christy, to your experience? Yeah. So Christy has been in physical therapy with us, and although we're not dealing directly with her feet, we're always looking at feet. We're always working from the ground up. So let me first say, I highly, highly recommend you do not go to Roadrunner, get them custom fitting you for orthotics. That they're not trained to do that. They are getting you on a video. They're then kind of marketing to you. I would not recommend that. I would speak to either a podiatrist or a physical therapist about your footwear. You then have to be smart about selecting the appropriate footwear for the appropriate engagement, right, or activity. Who's still wearing heels? Do you practice in them? If you're wearing them, do you practice in them? Yeah, make sure you're stable. Again, we're talking about where are we, we're talking about towing the line, right? So find that threshold for you, and the reality is there's going to be some risk in that. But most people are going to benefit from some type of insert, some type of orthotic, I've found. Again, everything works from the ground up. If you have a history of hip issues, if you have a history of back issues, a lot of times those are coming from the feet. So getting you in the appropriate footwear, and then adjusting that appropriate footwear as needed.
I have a
Very,
question.
very personalized, very specific.
Are Crocs good wear?
Yeah, Crocs can be good. Yeah, so Crocs, who wears Crocs? It's kind of a young people thing. My kids love.
I live in an after 55.
Oh, okay, yeah.
Only if you use the strap around that back.
Yeah. Thank
You,
you.
exactly, so are they built for speed or are they built for comfort? Right, exactly, yeah, so there's a strap on the Crocs. I'm looking at everybody's shoes while I'm going around, and everybody has different shoes on, I love it. Shoes are tricky because they're a lot about style,
They are.
right? And they're a
I'm
lot
not a Croc
about,
person, I just have to say that.
Yeah.
But that's something people have asked me in the past.
yeah, and they're a lot about function. It goes back to the medication topic, again, consulting your professionals, having open conversations with them is critical. I also think, just to piggyback on that, and I think I've talked too long, but to piggyback on that, it is really important that your healthcare professionals understand your lifestyle. I think that's, unfortunately, in healthcare now, we're losing a lot of that. They're not spending enough time asking you about your life, what you're doing, who you are, what your priorities are. The type of shoes that you're wearing, the type of house that you live in. These things are all very personal choices, and these correlate directly with your health. I think we're going to save questions till the end, but I can't wait to answer it. I'm going to pass on.
That was awesome. Thank you so much. So, quick review. So far, we've gone through 2 of the 4 evidence-based ways to reduce your risk of a fall. Karen shared with us the importance of talking to your healthcare professionals, your doctors, your pharmacists, having your medications reviewed. And then Dave so eloquently talked to us about the importance of maintaining balance and mobility through movement and wearing the right shoes. All right. Poor vision. Vision is definitely one of those things that can impact your risk of a fall. Why? What do you guys think? Brilliant. If you can't see it, you're more likely to trip over it. Thank you. Stands to reason. So having your vision checked on a regular basis is actually an evidence-based way to reduce your risk of a fall. I think earlier Karen asked the question, how many of you have regular vision exams? And I believe almost everyone in the room raised your hand. So you don't even need to listen to this slide. You're already doing it. Congratulations. You've already reduced your risk of a fall. If you wear corrective lenses, wear your corrective lenses. Simple, but true. Okay, next. The fourth evidence-based way to reduce your risk of a fall. We have a problem of environmental hazards. All right, ask us the question, what fall hazards can you identify in this picture? All right, give me some specifics. I hear the word everything.
No railing.
Okay, we got no railings on the stairs. Look at you pointing out there. What else? Yeah, crinkled rugs. What else do you see? Cords everywhere. What else do you see? The cat. The cat itself. So I know someone who does a whole workshop on fall prevention with pets, because there are so many times people are tripped up by their pets. All right, what else do you see that's a fall risk? The rug. Yeah, the coffee pot on the edge. So chances are we've got liquids on the floor, slippery, right? What else do you see?
The rug at the bottom of the stairs is loose.
The rug at the bottom of the stairs. Anything else on the stairs that's a problem? Yeah, I mean there's stuff on the stairs. And then I love that the lady who we don't even see in the picture, her shoes are like slippy slideys. And she's got wood stairs, which can be slippery. So yeah, there's a lot of things going on in this that are a fall risk. I also see what I think might be a cigarette butt on the wood table. I don't know how that relates to falls, but just not a good idea. We've got an open medicine cabinet and a bunch of open pill bottles over here. So that tells me somebody's maybe mixing meds. So we've got increased risks of falls there. All right, enough of that. We've talked about the problem. How are we going to solve it? We're going to make our houses safer. Yay! So guys, one of the reasons we focus on safety in the home is that statistically, most falls in the United States occur at home. We've done a fairly good job since 2012 when the ADA guidelines were made of making public places safer. Doors are wider, surfaces are smoother, there's not as many trip hazards. You don't see a whole lot of cords running around in this room. But our homes can tell us another story. So if you can make small changes to make your home environment safer, you can greatly reduce your risk of a fall at home. Karen, do you want to tell us about that?
Please. All right. So here are a couple simple things you can do to your house. So how many, these are my favorite. How many of you guys have throw rugs? Not anymore. Thank you, Carolyn. You're a very good client. Okay. Throw rugs. I call it the twist test. If you can get on your rug and do the twist, you know that dance, and it moves with you, it's got to go. Or you've got to tape it down. You could buy on Amazon, Lowe's, wherever you want to buy it. You can buy some rug tape, and you put it down, and it holds your rug safely in place. Anyone ever hear of rug tape? Or buy it? Good, I like that. How many of you have door knobs versus door levers? Right, so sometimes, like I have arthritis, sometimes twisting that way is tough. Can't open the door, that's a problem. So using a door lever, you can even use your elbows if you need to. Makes it a lot easier. So little simple changes in your house make all the difference. night lights, whether it's a regular night light plugged in to the wall, whether it's an under bed light that you step out and your light automatically comes on, and for you men, so you can aim a lot better in the top right corner, those are some options for you. Also grabbers. How many of you have grabbers? What do you use your grabber for? Someone tell me. You tell me. You. Mm-hmm. Sorry, I don't know your name, but your cute sweater we talked about.
Like when I drop anything, I can't bend over well because I have to keep going when I do.
So she said when she drops anything, she just uses that so she doesn't fall over.
And on shelves.
And on shelves. Perfect. Anyone else use it for something in particular? You want to share?
We got one, but we haven't used it yet.
Oh.
Because we'll drop something.
Got it. I use it in my washing machine because my washing machine is super deep and otherwise I can't reach the bottom of it to get the last sock. So I use the grabber for that. Thank you. I keep it on top of my washing machine so it's there all the time. Okay, and then another simple thing that we're not going to talk a lot about, but it's called anyone ever see that commercial back in the day? I've fallen and I can't get up, right? Now those are old school buttons and they still exist and they are great. We call them personal emergency response systems. Now some of you might have an Apple Watch with the fall detector. Anybody? Apple Watches? Okay. And some of you might have a bracelet that's a fall detector or a fallen and I can't get up button or a pendant. These products are lifesavers. There are too many times I've heard too many stories of people being on the floor for days. And no one knows they're on the floor, and it just turns into a bigger problem. I see you're wearing one. Thank you very much. You're a great model. Stand up and show everybody.
Oh, well, you have a similar one.
Okay. So having a fall detector, so there's different buttons that are just for in case of an emergency. So you fall or something happens, you hit your button and they'll say, "Can I help you?" And you say, "I want to order a pizza." Wrong button. But if you say, I fell, I need some help, that's the right button, right? And then they'll tell you, do you want us to call 911? Do you want us to call your daughter? Whatever the list of people you have. But there's a whole new or somewhat new class of these which have fall detectors in them. And when a fall, by definition, is a change in elevation, right? So me going from here to here might set the button off. It might, but it might not. If you suddenly fall, it will definitely set the button off. And that's what you want. You want it to go off and then talk to you. If you don't respond, they're going to call 911. That's their job, the operators. So having a fall detector is really a great tool to have in your tool belt. Okay, so I'm going to talk a little bit about some small changes you can make. So let's say you have a couple of steps in your garage. Look how nice and organized. Whose garage is that nice and organized? Not mine. But you have a couple of steps and they just really make it difficult for you to go in and out of the garage. You need to go in the garage, your laundry's in the garage. Well, then you could put a ramp in your garage. Sometimes, depending on the rise of your steps, is how far out your ramp needs to go. So for example, Kendra's more the expert on this, but let's just say it's 6 inches, so you need to go 6 inches out. 6 feet out, excuse me. So for every inch up, a foot out. So that maybe could be it's probably longer, but a 6-foot ramp, let's just say. And it has handrails and everything that help you with your mobility. Sometimes you can just do like the guy on the scooter, or the knee scooter, have a little threshold ramp. So it just depends on how high your rise is, of what kind of ramp is the most appropriate for you. Now here is a cautionary tale. Amazon is amazing to buy clothes, right? You can get really good deals on Christmas gifts, they send them for you, but not the best place to buy these type of equipment. And I'll tell you why. You're not an expert, I'm sorry to tell you. It's really important to speak with an expert who can help you pick the right product. So again, I can give you how to measure and all these things, but again, it might not be the best solution for you. So consult with the right person. Consult with your physical therapist, consult with the doctor, consult with an aging in place specialist, consult with somebody who knows what they're talking about. I actually just shared this story earlier with Kendra and Dave. So I have a client and the family asked me to go and assess for a ramp, And I did, and I assessed the whole entire house, and I gave them a whole entire assessment, and I said all the other things they need, and they said, we just want the ramp in the front. And I said, but that's really not the most important thing on this assessment. They said, but that's all we asked you for. And I said, that's great, because I saw on Amazon this ramp, what do you think? And I'm like, well, it's a good ramp, but not what you need, and it's not the best solution. And and again, he looked on Amazon, he thought he knew what he was talking about, and he thinks he does because he read the description on Amazon, and he just, unfortunately, is not the professional, so that's why you really need to go to a professional. And I always ask people, if your tooth hurts, do you go to the mechanic or do you go to the dentist? Somebody's answer. Well, if my tooth hurts, I'm going to the dentist because that's the right person to go to. So if there's a problem with your house, go to somebody, or with your mobility, go to the right source. So, okay, so again, small changes. You can have a threshold ramp, you can have a bigger ramp, you can have handrails installed inside or outside. With stairs, you should definitely have handrails at least on one side of your stairs, but sometimes two is much safer. Now these are not such small changes, okay? So if you have a 2-story house, sometimes the master bedroom or the bedrooms are all upstairs, and having a master bedroom downstairs with a full bath, not an option. You need to get upstairs. And also, you want to use your whole house. You're paying the mortgage on the whole house, not just the bottom. So you want to make sure you can get up there, and installing a stair lift is a great way to do that. That helps you get up there, and it's great for laundry too, so don't worry about it. You might need a ramp to get out of the house. It could be a simple straight ramp like I showed you earlier, or it can have, depending on the height and everything like that, of your stairs, you have to do a curved ramp or a multi-piece ramp. Also, on the next picture, is there a light on here? I don't know. Okay, the next picture is called the vertical platform lift. So instead of, do you see that one? Over there, can you see that? Okay. So it sort of the whole idea is that it blends in with your house. It doesn't stand out like, oh, you have a lift. So, but it blends in really nice. But what it is if you are in a wheelchair, you can wheel in there, and then it lifts you up like a mini elevator. And then it gets you to the top deck. So that's a great option for people who live in mobile homes. If there's just no really other location to put a ramp. Again, ramps take up space, and so sometimes this is just a better solution. And then that cool looking thing, anyone know what that is? An elevator. So they're becoming more and more popular to have an elevator put in your home. I'm sorry? It's just the shaft.
It's a VPL
Oh, it is?
enclosure. Mm-hmm.
Oh, well, tell us more about it.
Sure. So actually, all of these pictures are projects that our company completed. So I can tell you everybody's stories.
No stories,
But I
just
won't.
tell that.
So the 2 pictures on the right are actually both the same product,
Oh.
vertical platform lifts. So in the state of California, if you have a rise that's 5 feet or less, you can have an unenclosed vertical lift. So you have just the lift itself with the tower that has the lifting mechanism, and it can raise up to 750 pounds. If you have a rise over 5 feet, it has to be enclosed. So we're going up to a 10-foot deck. This was a gentleman who was injured in a bicycle accident and came home with a whole new normal. So he needed a way to get, and all the living space in their home is on the upper level. So that wheelchair lift is enclosed, he enters from underneath, and it does operate similar to an elevator. There are some differences in the mechanisms and things like that, but yeah.
See, I should have the person who knows about this talk about this. Okay, so number 1 place where people fall, where do you think it is? The bathroom. And why do we think that is? It's wet. Slippery. When wet? Floor rugs. Yep, that are not down. Anything else?
We're doing a lot of stuff in there.
We're busy in there. We are. And we use it quite often, right? It's not like a once-a-day occurrence you go use the bathroom. So that's and there's a lot of hard surfaces for the most part, right? So there's counters, there's toilets, there's sinks, they're all hard. So it's really important that this place is super functional and safe in your house because you use it multiple times a day. So one of the things you can do, these are just some examples. So one of the things you can do is if you have a bathtub, the first picture is called a shower, a transfer bench. You put the legs of the bench, 2 of them go outside your tub, 2 go inside your tub. And the person can sit on the edge of the tub, the edge of the bench, and then scoot over. And there's a handrail on the inside of the bench if you see it. And scoot over, there you go, thank you Kendra. And scoot over to get inside the tub. They even have ones that are on a rail that they're more automatic. You don't have to scoot your butt over. I mean, there's lots of options. They're padded, they're unpadded, lots of options. You got to find out from the professional which the best one is for you. The next one is a shower seat. Those you can buy them anywhere. That I'll tell you. I'll let you do that. You can buy them anywhere. They're great. They're easy to install. The thing I want to tell you is you want to make sure that it has arms and a back. Because when you're sitting, stand up. You can easily stand up without using your hands. But if you're having mobility issues, having handrails or armrests will really help you because you can push off the armrests. So that's a great solution. You can get that on Amazon, honestly. And anyone can get them. They're super easy to install. But again, the back and the armrests are the most important with that. And the measurement. This is another thing. Sometimes your showers are narrow, or your tubs, wherever you're putting it, and it might not fit. So measure the width of the bottom of your tub and make sure that the width of the chair is going to fit. Next is a toilet. So one of the things about this toilet is that it's higher off the ground. It's called a high boy. Does everyone have a high boy toilet? Yeah. Excellent, we like that. And it gives you a couple more inches to make it easier. And then the toilet paper holder happens to be a grab bar. Sort of sneaky. But there are new and modern things that are out there now that are grab bars, and they do 2 things. They're a grab bar and hold your toilet paper. Or they have ones that are towel bars and grab bars, and they have organizers in the shower as well that are grab bar shower bars. So that's that. And then how many of you like taking a bath? Not that many of you, okay. How many of you think having a walk-in bathtub is the best thing you could do?
It is wonderful. I have.
You have one, okay. Do you like taking a bath?
I love baths.
And how often do you use it?
At least twice a week.
Okay, that's great. Excellent. So when you're thinking about I love walk-in bathtubs, don't get me wrong, but here's what people don't think about. When you get in a walk-in bathtub, you have to close the door, right? And you can't just step into it. There's a door you can open and close, you sit down in it, you have jets, it's wonderful, but you have to wait for it to fill up while you're in it. People don't think about that. And you have to wait for it to drain when you want to get out of it. So people don't think about those 2 things. So it's really important. The new models that I've worked with, they have heated seats.
Yeah.
I always do an installation of a heat lamp above to keep you nice and warm and toasty. But these are things to consider. I've had someone say, oh, I need a walk-in tub. I'm like, do you take, oh, this is even funnier. I said, I said, do you like taking a bath? Not really, but I know they're safer for you. And I'm like, no, if you don't like them, they're not safer for you. You got to do it, again, what you like to do and what your habits are. Stick with that. We don't need to change those things. We just need to make them safer. So if you don't like taking a bath and you like to take a shower, then having a walk-in shower, that there's no change in threshold, right? So you just walk or wheel and you go right into your shower. You never know that you're going in your shower because there's no change in elevation. There's no lip. You just walk or roll right in. And then that picture just shows all the possibilities of things you can have in your shower. You can have a drop-down bench installed that folds up, that has a handheld shower head on a slide bar, plus it has a shower head that's fixed. We have grab bars in there. So these are all the different things you can do to make your shower safer. How many of you think suction cup grab bars, this is a leading question, but how many of you think suction cup grab bars are a good thing? You guys are so smart and into this, I tell you. Excellent. Okay. You're up. Now Dave is going to share more about things you can use in your house to keep you safe.
Yeah, so I think one thing, thanks Karen, is talking about, so the number one thing I hear from my teenage patients and my senior patients is I want independence, right? So everything we're talking about is how do we make the home safer so that you can do it on your own. Same thing with assistive devices. So assistive devices, we're talking about walkers, we're talking about rollators, we're talking about canes, we're talking about, right, wheelchairs, any of these devices that are going to allow us to continue to navigate our environment with a little bit of assistance, but so that you can maintain, ultimately the goal again is to always just maintain your independence. Go do the things that you want to do, and sometimes you just need that extra little adjustment. So Karen talked about this with regard to the home equipment. You got to be really careful just buying something, and especially preemptively. So my experience doing home evaluations with patients is they say, and Karen had a great anecdote about this. Oh, I'm going to buy a walker because I need one in the future, right? If you don't need a walker now, don't buy a walker now. The time will come, maybe. And then you'll work with your professionals, whether it's an occupational therapist, physical therapist, right? Somebody who can help decide what is the right or the appropriate equipment for you. There's four-wheeled walkers, right? There's rolling walkers. There's one-point canes. There's four-point canes. There's crutches, forearm crutches, wheelchairs. The choices are infinite, and ultimately it's again goes back to what do you want to be able to do. Where do we find that threshold so that if you need a little bit of assistance, how do we give you, at least from a physical therapist perspective, certainly if you say, my leg hurts when I walk, I'm not going, you're in a wheelchair, right? And if you talk to anybody who's pushing you, right, to the extreme, you should question that. We just want to get you just over the edge, right? I can do everything I want to do. What help do I need? That sort of thing. Was there anything else on assistive devices that you want to touch?
Just where not to buy them.
Yeah, don't get them on Amazon. And we didn't talk about occupational therapists, but occupational therapists do a lot of home assessments, and they will make good recommendations about what types of changes you might need to make to your home, particularly with regard to cooking, showering, right, all these daily tasks. And what a physical therapist or an occupational therapist who's doing a really good home assessment will do is they'll have you do everything and just watch. Right? And make some recommendations. And to be quite honest and to be fair with yourself, if your kids are saying, hey, I'm worried, mom or dad, I'm worried about this, it might be a good time to say, well, I don't want to hear what they have to say. But should I get somebody in to talk to me about that or to assess the way I'm doing it? Because it is easy to fall into old habits and say, well, I've always done it this way. But if there's risk involved, it might be worth addressing, and the answer may be, no, the way you're doing it's fine. But it also may be, there's a better way to do it, right? We have an easier way to do it, safer way to do it.
Dave? Awesome. One quick bonus word of encouragement, and then we're going to have a quick summary of everything we talked about today. The bonus piece of encouragement is, I think, all of us can be resistant to change. And that can include using a tool like an assistive device that we haven't used before. For me, it was the vanity of needing reading glasses. I didn't want to need reading glasses. For some people, it can be, I don't want to wear a hearing aid. For some people, it can be, I don't want to use a cane. For some people, it can be, I don't want to wear safe, ugly shoes. For some people, it can be, I don't want to ruin the look of my bathroom with a grab bar. We all have those little changes that we resist because it means we're admitting that our bodies are changing. And we don't like to do that. But just do it. Because all of those things, they're not symbols of age, they're not symbols of loss, they're actually symbols of independence and freedom. And if we can shift our perspective to see any of those things as tools that are going to enhance our life. I love my reading classes now because I don't have to have somebody read a form for me. I can read it myself. Thank you very much. So now my glasses are not only fashionable, they're a symbol of independence. And so whatever that tool is for you, if you can embrace that idea that using it is going to help maintain that independence, and as Dave alluded to, when your kids are worried about you, it's going to give them peace of mind. None of us want to be the reason our kids can't sleep at night. So listen a little, humble yourself a little, use the tool. That's your free piece of encouragement for today. Let's do a quick summary. What are the 4 steps you can take to reduce your risk of a fall? Number 1, speak up. Talk to your healthcare professionals. Let them know if you're experiencing changes in symptoms. Have your medications reviewed by a professional. Number 2, keep moving. Increase your level of activity. Get help from a professional like a physical therapist if you need to know what's appropriate activity for you. Excellent and important. Getting your eyes checked, checking your vision regularly, and making your home environment safer. If you can implement those 4 things in your life, you'll greatly reduce your risk of a fall. And those of you who have had falls in the past, that's how you fight those statistics of having another fall. Do these things, and it's going to help reduce that risk. All right, I'm going to give this back to Christy. Who is there?
Here's just resources.
Oh, some resources. The Vials of Life, we were going to bring some, but I don't think we had them. The Fall Prevention Task Force, County of San Diego, has Vials of Life. That is a place where you put important medical information so that if you have an incident at home, when a first responder comes, they'll find that vial of life and know what they need to know.
If anyone wants one, because I did forget them, I can give them, you can either give me your name and I can mail it to you, or I can give them to Christy for next month.
Good plan.
Your choice.
And then community resources, the County of San Diego has a program called healthierlivingsd.org. There are free online and in-person Tai Chi, yoga, movement classes, things like that. These are some evidence-based fall prevention programs. Moving for Better Balance, A Matter of Balance. There's something called Bingo Size, which I haven't tried, but I want to. And Tai Chi for Health as well. These are all programs that are offered by the County of San Diego. And you would want to check those out.
So I have to ask for your forgiveness. When we first started, I usually have them, each panel person or presenter, tell just a bit about what they do in their life and their business. It's not to sell you, but so that you're aware, first of all, of why they're experienced at it, but also so that you understand if you have that, where you can go for it. So Karen, if you'll just take a minute, each of you, and explain who you are and just what your company does.
Sure. So I'm Karen with Seniors Choice, and I started my company 16 years ago. My background actually is in social work and marketing, and 16 years ago my partner and I decided that we should help. We love helping seniors. That's what I've been in for years and years and years as a social worker, and we decided that people need a trusted resource to have their house fixed. That's how it really started. That, having a stranger come into your house to repair a light bulb, or change your light bulb, or install a ceiling fan, or whatever it was you really want someone you can know and like and trust. And it's really hard in the industry of construction to find those people. And so we started out as a handyman company in 2016, and then it grew because our customers kept saying to us, and Carolyn actually was one of our first customers, our services just grew because people asked us, like, well, can you redo my bathroom? Well, no, we're just a handyman company, and in the state of California, over $500, you need to have a contractor's license. So about a year into the business, we were having a business meeting and we were talking and I was like, time to get our contractor's license, like that is really gonna make a difference. So we went ahead and got our contractor's license. So we're general contractors and like I said, we've been in business about 16 years now and we do projects, anything as small as a home assessment, which is definitely part of our services. We'll come out and do a home assessment and give you an evaluation of everything in your house, not just the one area you think you're having problems with. Because the reality is, if you're having problems in one area, you're probably avoiding other areas of your house. And I'm gonna help determine what we can do to make it safer. And I call it future-proofing, a plan not only for today to fix what's going on now, but also for the future and looking forward. And again, we're general contractors who can do any type of project like that.
You pass the mic to Kendra, please.
Hey, again, my name is Kendra French. I'm with 101 Mobility of San Diego. We are also a licensed general contractor, but we're not remodelers. We specialize in installed equipment, things like you saw in some of those pictures. Pretty much anything with the word lift in it, we can do. We do overhead ceiling lifts for if you have a loved one who's a wheelchair user, devices that help transfer them from wheelchair to bed and bed to wheelchair. We do stair lifts, we do wheelchair lifts, we do ramps, handrails, grab bars, aquatic pool lifts, installed equipment. Having our general contractor's license allows us, if you happen to need to have an electrician install an outlet for a device, or you happen to need concrete work, like for one of those wheelchair lifts, we can hire those subcontractors. So that is what we do. We make your home safer with equipment.
So I did a mini introduction earlier. So my name is Dave Gerbark. I'm a Gemini, and no, I have 3 children. I started my physical therapy career 12 years ago, and then I started my practice in 2017. To do physical therapy quite a bit differently, my team all has, we're all doctors of physical therapy, which is not to be confused with a physician. We have our clinical doctorate, which is a DPT. So it's a 3-year postgraduate program. And essentially the focus was so that physical therapists could be better primary care providers, meaning we understand pharmacology better, we understand histology a little bit better, so we can speak a little bit more eloquently and a little bit more intellectually about drug-drug interactions, how that might impact your balance, those sorts of things. So my practice is called 19 Physical Therapy, and we have 2 locations. One is, our flagship is in Solana Beach. Our other location is on the border of La Costa and San Marcos, up at Rancho San Fe and Melrose. We don't contract with any insurance. And I say this to let you know that we're private pay, so all of our clients pay us cash. And that's because we're providing a really high level, we're providing very high quality care. We don't use aids, we don't use texts, those sorts of things, and I don't want to sell you too much, but it's to tell you that Medicare doesn't allow us to accept cash from Medicare beneficiaries, from Medicare patients. I saw enough adults who were over the age of 65 who wanted to stay really active. I made a conscious decision that we would contract with Medicare, and that's the only insurance that we contract with, so that we could provide a quality service that we do for seniors.
Thank you. So we're going to move on to questions and answers. So if you have questions, Harriet's on this side, Chris is over here. They'll bring a microphone to you. Please keep your questions simple, 1 question each, and we'll go from one side of the room to the other. So if you have a question, please raise your hand, and if it's directed to one person, please say who it is, okay? Any questions? Okay, there's one back here. Very good.
Talk more about how you deal with the fear.
Yes. Yes, thank you. What was your name? Linda. Hi, Linda. So my primary focus the first thing that I do in an initial consultation is to identify the cause of the fear, right? So is it a history of falling? Or are there other factors? We were talking about a book that I really liked prior to this meeting called The Power of Habit, and it really talks about keystone habits and how changing behaviors is very challenging. Changing feelings is also very challenging. So getting to the root cause of the fear is priority number one. And oftentimes, fear of falling, it is tied directly to a history of falling. And so we need to get an extensive kind of background on that history, right? How frequently were the falls? Were they because of the same mechanism? That sort of thing. In my practice, a lot of it is interpersonal communication, right? And figuring out how can we, I'm not a psychiatrist or a psychologist by any means, but certainly there's some element of therapy there, is how can we talk through that fear and identify what the causes are and what our approach to working around that is. But from a physical therapy standpoint, for the most part, we're going to take that graded exposure approach of showing you that you can do things, right? So we'll create a safe environment, then push your limits a little bit more, right, with us, right? How can we challenge you a little bit more? And as we do more and more and more of that, your confidence builds. You then employ that into your life outside of the facility. So even if my patients, when I work with them, if it's for twice a week, it's still only 2 hours a week. So ultimately, it's what kind of tools can we give you to take home with you? Adjusting the home is also an important critical factor, right? So how can we change things in our environment so that we are not looking at them with a lens that is fearful, right? So if we know stairs are fear-inducing, certainly from my standpoint, I can say, let's train more on the stairs to build confidence there, but also maybe there's other ways to reduce the perceived risk of the stairs, right? Change the handrails, change the footing, those sorts of things.
The lighting.
The lighting, right, yeah. Right, so it starts with an extensive history, figuring out what the cause of your fear is. Did that answer your question, Linda? Thank you.
Does anyone else have a question? Okay, go ahead.
I was walking with an old farmer that's local, and he said, you know, we were talking about falling, and he says, you always know an old farmer, because they're always hunched over because they have to walk, watching the ground all the time because of potholes, snakes, rocks, what have you. Because you can always tell an old farmer because they're hunched over. And ever since that time, it's watching where you're walking. And one time I fell, I was hurrying and not looking down and tripped and smashed my knee. But watch where you walk. You know, keep your eyes to the ground. That was an advice from an old farmer, not me.
Any other questions?
Can I, that was great, yeah. I always think about it like, anybody who skis knows this, right, or cyclists, you want to kind of spot forward. And most falls occur when we're trying to, now the guys don't have a problem with this because us guys, we've never been good multitaskers, but the women are typically going to be multitasking, so it's I have my purse, I'm reaching into my purse, I didn't see the curb, that sort of thing. So attention to task, right, redirecting attention to task, doing one thing at a time is another.
So thank you very much. I'm going to have it, let's all give them a hand. And ask them to step off the stage while I do a couple more comments before I have you leave. Yeah, thank you. So, if you would please pull out the yellow form and fill that out. That's a feedback form. And if you want to attend to any of our seminars next year, there's a place in there that you can check that. Also, if you want to join us for the community tour next week, on Tuesday next week, there's a place you can check that. If you want to do any of those, please fill out the bottom part that has your name and how I can contact you. And I just wanted to take a moment and say that it's hard to believe that 2024 is almost over. And I am grateful for each of you and your continued dedication to learn and improve yourselves. It's been a pleasure to share this time with you. And I'm looking forward to 2025, and I hope to see each of you come at future seminars as well. Thank you very much.